Healthcare Professionals, Legal Risks and the Effects on Our Healthcare System by Erica Slusser. A healthcare professional is anyone who prescribes, supplies, or administers a medicinal product or service. It may be a doctor, a nurse, a pharmacist, or a dentist. Many of these professionals are certified, registered, or licensed through education, training, and certification from state boards. They're vital for our society as well as our economy. We must utilize protective and preventive measures to ensure an adequate health care workforce. Medical malpractice is misconduct or failure to meet a professional standard of care that results in harm to the patient, sometimes also referred to as negligence. This carelessness, whether accidental or intentional, can result in a medical malpractice lawsuit. Healthcare workers can protect themselves from malpractice claims by involving the patient in providing quality patient-centered care and through meticulous documentation. Additional ways are trusted use of technology, obtaining informed consent, quality communication, defensive medicine, quality insurance, and process improvement. These are just a few additional tactics healthcare workers can use to provide excellent care while protecting their own careers. Medical treatment carries a risk of causing harm that may lead to the patient being even worse than they were before. Even if no treatment is provided, perhaps because the condition was not recognized, this may also be harmful. If a patient comes to harm as a result of a healthcare worker's action or inaction, this may lead to a claim for negligence. Patients can file lawsuits against healthcare professionals seeking monetary damages for negligence that resulted in harm. Malpractice insurance is a professional liability insurance protecting healthcare professionals from errors such as negligence, misrepresentation, and inaccuracies in their advice. It provides monetary coverage in the event a lawsuit is filed against them. Though many malpractice cases end in the favor of the physician, malpractice lawsuits have extensive financial, social, and emotional effects on patients and healthcare providers alike. According to a 2004 study by the Journal of Medical Practice Management Unlimited, uncapped medical malpractice litigation added as much as $97.5 billion annually to the cost of hospital and physician services. It increased the annual cost of employer-provided health insurance by as much as 12.7%, decreased by 2.7 million the number of workers and their families covered by employer-provided health insurance, caused a 6% decline in physicians in the United States, many of whom work in critical specialty areas, created a lost access to critical medical services for up to 14.4 million people, resulted in malpractice underwriting losses of $8.6 billion in 2001, which is double from 10 years prior, and had a low predictive value in identifying whether medical malpractice had occurred. Because healthcare professionals are vital, we must utilize protective and preventive measures. We must ensure an adequate workforce. Otherwise, we may face a shortage of professionals in the future that could seriously impact the health of our society.